Hey everybody, Dr. Anise Khalaf live here from Acupuncture Fit, and I've got one of our patients who has just really improved amazingly well with like flying colors since he first came in. His name is Richard, and hey Richard, thank you so much for being on today.
No problem.
Awesome. So first off, I just want to ask you, how did you hear about Acupuncture Fit?
I actually heard about it from my wife, who had already been seeing you a couple of times and had given some glowing reviews, and I thought, well, if she is enjoying it so much, then I better check it out.
Fantastic, Richard. And how was your life before acupuncture?
Well, my decision to want to come in and seek treatment and kind of pursue this process was the result of me doing a New Year's resolution where I decided I would do kind of a deep dive into the state of my health, and I made a list of all of the things that were bothering me or that I knew I'd neglected, and was shocked when the list was 22 items long. And I recognized that a lot of those things were just literally they were neglect, and they were things that I pushed off. And that some of them, I didn't put bald on the list because that wasn't something I was worrying about. I was really just looking at the things that were, that I felt were lowering the quality and the standard of my life, or that I thought over a long period of time were going to be seriously detrimental to my health and perhaps ultimately my life.
And Richard, what were some of those things that were really debilitating you? I mean, you said something really key. In our practice, we always say that 3 causes of many diseases, or mostly all diseases, are thoughts, traumas, and toxins, right? All those 3 things. So maybe speak to those listening. And before we go into that, I just want to let everybody know, thank you for watching. I see we got a bunch of likes and comments starting to come through. And if you have any questions, hit that like button and hit that share button, and also post a question in our comment box, and I'll answer it personally. So we're talking right now about Richard and how his life was before acupuncture, and really what was going on that was really debilitating him that led him in here.
Right. Well, my list of things that were serious started with gout. I was having major gout issues. I'm talking about toes and ankles and knees, both legs, debilitating enough that I was walking with a cane from time to time. Sometimes I just literally would take 3 minutes to get from the bed to the bathroom. My ankles and my feet hurt so badly. There was one time we were actually going through an airport, and my wife had to roll me through the airport in a wheelchair, and that really was a pretty serious wake-up call. And that was coming on for a long time. It was just something that I really ignored. I was having problems with my hips, which were not gout related, just a matter of not getting enough exercise and movement and blood flow. I was having problems with lower back. My weight overall was an issue, and and don't even get me started on my pre-diabetic situation, where my glucose numbers had gone way out of the pre-diabetes range into the I think 146 range, where my doctor wanted to put me on insulin, and that was a very serious wake-up call.
Good. Anything
else? Those are
good.
the major things.
No, this is a great testimonial.
I won't add warts and little things here and there that needed to be handled, and the rogue age spot. But those were the serious things that really got my attention.
So then my second and final questions are how was your life after acupuncture? Maybe walk the people that are listening through a little bit of your experience, and then let us know the results that you received.
Yeah, well, what's interesting about the acupuncture thing is that it's something where I don't know that how the average person responds to it. The first couple of weeks, it was really hard to say exactly what was happening. It was about the 1 month, spot, about the 1 month, 4 to 6 week spot, where I started noticing, serious differences. I started having pain reduction. The inflammation was down. My hips felt better. And in fairness, because I don't want to create any type of false illusion. I was doing other things. I was doing the things you should be doing. I was eating better. A lot of that was at the direction of Dr. Anise in relationship to the foods that I was eating that were really damaging. And I think that's one of the things I like best about this program and about what I've done over the last 5 months is that it has been it's inclusive. It covers a broad range of different areas, including discussions on fasting and vitamins and all different things. When combined, I think create the overall package. Right now, 5 months later, I am unbelievably happy to report, and I mean really unbelievably happy to report, my gout issues have fundamentally gone away. My hips are night and day different. I mean, if I lay in bed for 6 hours on one side, I can still tell the difference in the morning when I wake up, but the general feeling that I have in my pelvic area and my hips, night and day. I think almost everybody who has met me and has seen me within the last couple of months has asked me, what are you doing? What's different? Why do you look better? Why is your skin glowing? I can tell you, I did not come in for glowing skin, but I'll take it. I'll take it. It's one of those things where I was worried more about infrastructure issues than I was about the exterior and the cosmetic issues. But I think it's a plan. It's having a plan that covers all areas of your life, the diet, the whole nutrition aspects, and then combined with the acupuncture that I think makes the big difference. I will just say this to wrap up. My Western doctors have failed me for years. And I don't mean that they don't know what they're doing. It's just that what they do too late. They're always treating the symptoms on the back end. They're always looking at everything. Every visit seems to be adding another pill instead of trying to get somebody off of pills. And increasing your medications and then adding new medications to counteract the previous medications is literally it's a path to insanity. What I've done with Dr. Anise has really been to try to restore myself to what would be a natural way of thinking and feeling and living. It's a long process. I didn't get into the bad state I was in 6 months, and I'm not naive enough when I walked in to think that I was going to repair 30 years of bad behavior in just a few months. So this is going to be a process still. I still have weight to lose, and I still have some issues that I want to work on, but after 5 months, I'm pretty damn happy.
A list of 22 things down to a list of maybe a couple is remarkable if you ask any physician, natural, conventional.
Yeah.
It really is. And also to wrap up, one of my favorite things about you, Richard, is Richard did a week-to-week challenge where he would donate money to charity if he did not lose the weight that he did. Yeah. So seriously, the self-initiative that he took, and it shows in what he's done. And I can't give credit just to our medicine. It's everybody that was helping him, but mostly it's what Richard did for his health in addition to the integrative medicine approach. One last thing, Richard, you were not even able to barely walk and even work out, and now you're climbing how many steps? If you want to tell everyone a little bit about that, and then we'll wrap it up.
Oh boy! Well, during the month of May, I decided to do a challenge. I live in my wife and I live in a 25-story high-rise in downtown Orlando, and I guess I'm kind of an all-or-nothing person. So the average person would probably say, boy, I'm going to see if I can climb to the top of that building. Well, I don't know how to do anything small, and I started feeling just so good about the idea that I could move and that I could take on physical challenges. So I decided I was going to walk to the top of the City Tower building in downtown Orlando, which is 25 stories, 4 times a day. 4 times a day is 100 flights, and that would be the equivalent of the Empire State Building. So I decided I was going to do that every day during the month of May, and I have about 10 days to go. I'm 2 buildings behind because I did overtax myself at one point. I wasn't quite as good a shape as I had hoped I would be, and so I got a little bit behind, but now I'm kicking it again. So by the end of May, I will have climbed the Empire State Building 30 times in 1 month, which is about the equivalent of the top of Mount Everest. And so I don't know if that's not a that's not a testimonial. I don't know what is.
I mean, my gosh, wins all the way around. Richard, you are a true hero. You're donating money to charity. You're climbing the Empire State Building 30 times, and you came in here barely able to walk. Seriously, much kudos to you if you're watching this and getting some sort of inspiration, or you know somebody that's watching this. Please, again, hit that like button, hit that heart button, write a comment, share this with your friends or family. My name is Dr. Anis Khalaf. Richard, thank you so much for being on today, and I hope everybody has a happy and healthy week. Until next time, my name is Dr. Anis with Acupuncture Fit. You can download my free ebook on our website, An Ancient Guide to Your Body Type, and we look forward to speaking to you and being live very soon. Take care. Bye now.